Okay, so thank you very much for inviting me to be here today and for coming to the Zika talk. I'm going to be talking today about congenital Zika syndrome, and I'm the director of the International Centre for Evidence in Disability at the London School of Hygiene. So a lot of you are very interested in the vector, so we're sort of at the different ends of the spectrum. So you guys have been focusing a lot here at the beginning, wherever the pointer is, in terms of the transmission and the mosquitoes to the humans. And I've been looking all the way at the other end in terms of the babies and the impact on the babies and what can be done there to help. But in listening to James and Anna talk, I think my people need to talk more with your people. So this quote about that Zika is showing a gap in vector control, actually this is something we've been feeling very much about disability as well. That what has happened is all these babies have been born with congenital Zika syndrome, and suddenly the world's sitting up thinking, actually childhood disability has a massive impact and it's really important and we don't know what to do about it. So it's been exposing a gap there. And then in the graph that Anna showed, she was talking about various vector-borne diseases. So there was lymphatic filariasis, there's leishmaniasis, onchocerciasis, and all of these are disabling. And if I throw in things like trachoma and leprosy, we can see that actually the NTD agenda really needs to encompass vector transmission, but also the other end of the spectrum of what happens to people who get these diseases and are living with these diseases. So we're all kind of part of a continuum. So what I've been working on very much is these babies, and these babies who have been born affected by Zika. In Brazil, and that, as James was saying, is what made us all kind of sit up and start to take notice a little bit about Zika, sorry, I worked on trachoma before, about Zika and what to do. So I'm going to explain a little bit about what the impact that this has on the child. I'm only an epidemiologist, not a clinician, so I may not be able to answer all of your questions. But essentially, microcephaly just means having a small head. And there can be lots of debates about how you measure a small head, and is it less than 2 standard deviations or 3 standard deviations. But it basically means having a small head. And actually having a small head can have a range of impacts, that actually people can have quite functional lives, normal lives you might say, with a small head, or actually they may be really severely affected. And what seems to happen with Zika is that these children are pretty affected by having microcephaly. So that there's been a range of head and brain abnormalities that are documented, spasticity, seizures, so we're hearing about babies having seizures every day, irritability, feeding difficulties, eye abnormalities and bone abnormalities. And we have to remember again that these babies are mostly under 2, so that if these things are already apparent, especially around some of the more behavioral difficulties, they'll become even more apparent as the children grow. So just some of the pictures. So microcephaly is often in Zika goes together with calcification of the brain and kind of abnormal structures of the brain. So it's not just that the brain is small, but there are abnormalities there. You can see, so there are lots of different ways that you can have microcephaly. This was not a brilliant picture. I tried to find a better one. But you can see that the child's head at the back has got a kind of a bulge. And what that implies is that the brain was growing and then shrunk, or that there was a fallback, so that the skull bone sort of collapsed, which is different to other kinds of presentations of microcephaly. You can see lots of, this is arthrogryposis, so lots of bone problems with these babies, and also ocular problems which may affect their vision as they become older, which is difficult to judge now because the babies are still pretty small. And irritability. And so this is a baby crying, and this is, I don't know, I'm a parent, many of you may be parents, but babies crying is like fingers down a chalkboard, and these babies cry for hours and hours and hours, and they're extremely high levels of irritability. And so that's the kind of the spectrum that's being seen with microcephaly at the moment, and that also kind of, some hearing problems, maybe yes or no, and so on. But you'll get a prize for the person who spots the odd one out in this picture. So there's a baby here at the bottom who doesn't seem to have microcephaly. Okay, so the others all have a small, not just a small head, but a kind of disproportionate head, and that child doesn't. And actually what's becoming apparent is that there are quite a lot of babies who, or young children who seem to be affected by the syndrome, but don't have microcephaly. And so the scope has broadened out a little, and they also show some of those brain abnormalities with calcification, but without the small head, without the microcephaly. And so now, instead of thinking just about microcephaly, there's a more discussion around congenital Zika syndrome, which can be microcephaly, but it can also be children with other patterns of brain damage or damage to the back of the eye, these kinds of joint problems like I showed you with clubfoot, or too much muscle tone. So that there's the microcephaly was what was apparent first, and then it's become apparent that there's a lot of children with normal-sized heads who are developing quite severe problems. But actually, even that may be the tip of the iceberg. And there's more evidence to suggest that maybe, it's very rough numbers, for every child with congenital Zika syndrome, there may be up to 10 children who are affected by a range of other kinds of impairments, but less severely, but also bearing in mind that these children are still under 2. So it's still quite difficult to see where normal development, where there's kind of where it's within the range of normal development and where it's really falling behind. But what's very clear is that the numbers we're talking about are going to be very large. So if there are a few thousand children just in Brazil with congenital Zika syndrome, we're probably talking about tens of thousands of children that will be affected by a range of developmental disabilities. And the true picture is going to emerge over the coming years. So then we have to think, okay, they're these babies, they're born, they're here. So as I think James said, the Minister of Health in Brazil said these are a lost generation. But actually this lost generation are here and they're living and breathing. And what are we going to do? And if we think about impact, there are lots of different levels in which we can think about impact. So this child is born, and that child has an impact on the mother, the father, the grandparents, the family, the community, the health system, and it spreads out and out. And actually will have a very big impact in Brazil or other countries which are affected by Zika. And the kinds of areas, and so I'm just flagging some of the research we're doing about this, we've been looking at the impact, looking at the family, about pregnant women, the kinds of concerns that they are experiencing today in Brazil, about the community, about fertility decisions and so on, and also about health professionals and the health service. And so the impact is going to be very broad, and it'll be probably both social and economic. Now, a lot of these pictures are focusing very much, a lot of the research is focused on the babies. So these kind of clinical studies, what is happening with this baby, what is exactly the clinical profile and so on. But if we expand out from the baby, we look often first to the mother, and the mother is usually the primary caregiver. But actually, the child is born within a family. Fathers are obviously also incredibly important, and then in this context, we're seeing a very big role for grandparents, particularly grandmothers. And so we have to think about how they are affected and the kinds of ways in which they can be best supported. Because disability is experienced very much at the level of the family. It's not just about what happens to that individual person. And these families, these babies are born into context. They're not in isolation. So we've been doing some qualitative work around this, and I've given you some examples. This picture is not related to the particular story. I'm saying that just for confidentiality reasons. So for instance, Zika is affecting poorer communities, and these babies are being born more in communities that are poorer. So for instance, the first mother used to work as a housemaid. Now the entire family lives off her disability pension, which is being given for children with microcephaly. She has 4 other children, so this is a very common story, that they're large families, lots of unwanted pregnancies. She was using birth control when pregnant, and that there's intramarital violence and partner abandonment. So you think about the baby being born into this kind of context, which is already quite complex. Or a second mother, first married at 15, she never worked. Again, it's supported by the disability benefit and has other kinds of children. So what is that going to impact in your ability to care for a child with very complex needs? And then what you hear, so the baby's born into this context, and what you hear a lot is an initial kind of crisis. I cried a lot, I thought, God, my daughter, but after a while, it's my daughter, what can I do? And I've been going to Brazil periodically over the last year, and I feel that you can see that at the level of the family, but you can also see that more nationally, that initially there was this crisis, what to do, and now there's more of a feeling of, we need to cope, we need to move forward and do something about this. So in trying to work out what to do, you have to think about where the impacts are. And so these babies being born into these contexts, so Brazil has lots of political disruption at the moment, families with lots of different needs, and the kinds of impacts are going to be economic in terms of poverty of the family, social support. There's going to be lots of unmet needs for things like contraception. There's going to be health needs of the child, mental health, concerns about the parents, and questions about stigma. And a lot of the response has been focused on the health needs of the child and not focusing very much on these other aspects where there's very large needs. And what you see is that these children, particularly in Brazil, are getting very good care, but it's a massive pain for them to get it. So they're seeing pediatricians, specialists, neurologists, speech therapists, physiotherapists, but it takes 2 hours to travel there. So this is taking a long burden on the families to be able to provide all this kind of care. And then we have to think this is the children with microcephaly. Once you expand out to the children with other congenital Zika syndromes, they're getting a lot less care. And if we're thinking about the full spectrum, where I showed that that was just the tip of the iceberg, we can see that there are going to be enormous gaps in the healthcare provided for these children. So we need to think a little bit more about how to address these other areas of impact. And kind of nature abhors a vacuum, and so different things have been filling in, coming into this vacuum. So these babies have been born, there are very good health services, but those health services are not enough. So different groups have been developing in clinic-based to try and support the needs of these families. So this is one in Recife, where mothers come and they're given specific training very intensively, and things like these beautiful packs to try and stimulate their children. But they have massive waiting lists. They cannot meet all the needs. There are other groups that are trying to set up this kind of meeting these medical needs in a more informal way. So this is a group of mothers who raise their own funds, mothers of children with congenital Zika syndrome, to try and get physiotherapy and so on for their children. There are very active WhatsApp groups between the mothers of children affected by Zika, but also cerebral palsy and other disabilities, again, to provide more informal support, but not really structured help about how to come to complex needs. And then you get these organizations like this one, Abraço. So again, this is the one that was set up by 2 women who had babies with microcephaly. And they set up this organization in Salvador. I think there are about 70 women with their babies who come every other week. And they try and do something kind of uplifting and fun, as well as give practical support. So a lot of the medical appointments are very heavy, you know, what's wrong with your child now and so on, whereas here they try and make it a bit more fun. So when we went there, it was Easter, and there was this group of 70 moms sitting around with their babies, and all of the babies, most of them with microcephaly, had these little bunny ears on in order to celebrate Easter and just to do something a bit more fun. And when we were asking the different mothers what did you like most about this group, this one mother said, we watched Tarzan together. And we're like, okay. And she said it was, you know, a story about this monkey, and she gets a human baby, and they're different species, but the monkey loves the human, and that's how I feel about my baby, and it was a way to be able to discuss that. So these kind of groups, you don't quite know which direction they're going to go in and which needs they're going to meet, but they seem to be very important. But there's still this very big gap. So there are good health services, there's growing social support, but there's a gap in the middle about how do you get those health services to be more community-based. And so we're developing work at the moment about support groups for parents with children with congenital Zika syndrome. So it came from our work on cerebral palsy. So we developed something similar for cerebral palsy, which is has very similar impacts. So cerebral palsy is probably the leading cause of childhood disability. It's very common, huge gaps in services. So we've developed a parent training package where 10 groups of parents with their children come together, and they have weekly sessions on quite practical things about how to feed their child and communicate and position, but also more social support and moving into having it as a self-sustaining group. And it's been very successful. It's been downloaded something like 3,000 times. And so we're adapting this to look more at Zika. So we're focusing more on early stimulation. We're looking at some of those specific health needs, which I mentioned at the beginning, like visual problems and daily seizures, and looking more at psychosocial support. And we're about to start piloting that next month. So those are the kind of main, there are other kinds of interventions that are going on to try and address those other points, but what we're trying to do is come up with something that's more holistic to try and meet the wider stigma, mental health, unmet needs, social support, and thinking also about economic support. Just finally, briefly, the other thing that Zika is showing is gaps in the health system. So Brazil actually has a very good health system which goes down to the primary level. And so it has, it's been used as kind of a model, particularly in Latin America, about how to set up a very comprehensive health system to meet universal health coverage. But what Zika is showing is gaps in the health system. So these children who are living in rural areas are having to travel 2-3 hours just to get physio appointments, and that there needs to be more strengthening at the primary level to be able to support the needs of those children. But actually, as James said, 15% of the population will have a disability anyway. So what Zika is showing is a gap in the health system around disability, which needs to be addressed more broadly, just as it's showing gaps in vector control, which needs to be addressed more broadly, looking at other ends of the spectrum. So again, we're thinking here about training and supporting health networks in that way. So just going all the way back, again, we're looking at different ends of the spectrum. So you're looking at the vector control and the prevention, and that's obviously incredibly important. We're looking at the other end, kind of acknowledging that these babies have been born, and babies like this will always be born, and we need to be able to work out how to cope best with them, thinking in quite a holistic way. And I was fortunate to get to know one of the mothers who'd set up those that parent group fairly well. And so I asked her, what would you like to say? You know, if there's a group where I'm presenting, what would you like people to say that is needed? And so she said, we would like our children to have the best possible treatment, to be welcome in society with a lot of love and affection, just like any other child, and finally to be happy. So it's quite aspirational, and we also have to acknowledge that these children are not going to have lives like other children, but that if we think of vector control and control of diseases holistically from the vector to try and support these children, that's quite a good aim to have in mind. So thank you very much, and I just want to acknowledge the different people who funded the work we're doing and the different partners, but I know it's very boring to list all of them, so thank you.